Now, it's generally believed that hair loss is hereditary, but it is caused by a recessive gene that has got variable expression. The hair loss gene can skip generations, can skip siblings in the same family. One brother can have hair loss, the other brothers don't have it. In the same family, one generation may not have hair loss and the next generations may have it. So the hair loss is not totally based on genetics. Genetic history or family history of hair loss only means that you can have it more easily as compared to others who don't have a history in their family. Even if you have a history of hair loss in the family, again, it does not mean that you have to suffer the hair loss. Suppose your father is diabetic, you can stop eating sugar, you exercise, maintain good BMI, don't put on weight, you will not get diabetes for the rest of your life. Similarly, the history of hair loss in family only means you are likely to get it. You are not supposed to get it, and you can happily get it even if nobody in the family has got hair loss. Dandruff is again increasing from exposure to pollution. Dandruff is just like sweating. Somebody sweats more, somebody sweats less. So by nature, by the makeup of your body, some people secrete more dandruff, some people secrete less. The best way is to wash it off and keep the scalp clean. Now people are afraid to wash off the dandruff because they say washing the scalp causes hair loss. So don't worry about the hair loss. This hair can grow back, but if you keep your scalp unclean, it causes an unhygienic environment for the hair to grow. So dandruff can be taken care of by very well selected shampoos, by very well selected Ayurvedic oils, and by frequent washing of the scalp. Keeping your scalp clean is one of the parts of growing the hair better. You must select a daily use shampoo which does not have any chemicals or additives. Don't select shampoos which say that this is a curly hair formula, oily hair formula, dry hair formula, frizzy hair formula. Formula shampoos contain additional chemicals added by the scientist thinking that they should benefit a particular type of hair. You are not sure whether that is exactly the hair that the scientist had in mind. So keep away from formula shampoos. The basic requirement of the shampoo is to keep the scalp clean. So pick up a mild shampoo that has got no other added function, which is pH balanced and which works in hard water as well as soft water. You should wash your hair at least 4 times a week. Frequency of shampooing depends on how much you go out of the house and how much you are exposed to dust dirt environment every day. If you are exposed to dust dirt environment every day, if you are sweating, if you exercise every day, you must wash your hair every day. We have patients who wash their hair 2 times a day with a nice pH balanced soft shampoo. Keeping the scalp clean is a part of growing it better. If you are afraid of losing hair because of the shampoo, if you wash once in 2 or 3 days, the hair weakened or broken in 3 days comes out with one shampoo. If you wash in 5 days, the hair broken or weakened in 5 days comes out with one shampoo. If you wash every day, the hair that weakens every day will come out with the shampoo. So not washing for the fear of hair loss leads to further unhygienic scalp. Please wash your hair regularly, at least 3 to 4 times a week. Now, hair oil is mainly used only in the Indian subcontinent and surrounding countries. All over the world, people never use hair oil. The use of hair oil in this subcontinent is because of the temperate climate, because of the heat, which allows you to keep your hair and scalp manageable or soft. The oil that you use, especially when you use coconut oil, has got a property to be absorbed into the hair shaft. Up to 76 to 80% of oil can be absorbed, coconut oil can be absorbed into the hair shaft. Other oils are absorbed only around 50 or 56%. So when you're looking at applying oil on your hair, coconut oil is still the best. When this oil is absorbed into the hair shaft, it prevents the dust, dirt, damaging factors from entering inside the hair. So it indirectly protects the hair from damage, but it doesn't directly grow hair. Your hair quality, texture will be better, maintenance of the hair will be better, but the oil does not directly result in hair growth. The second type of oil which is being used for hair care is sesame oil. Sesame oil is selected when you want the oil to pass through the scalp skin. Sesame oil has very good penetration through the skin, though it does not have very high penetration into the shaft. So if you have actives or ingredients to be delivered into the hair roots, selection of sesame oil is good. And if you want to use oil for protection of the hair, coconut oil is good. These oils can protect your hair, help in maintenance, but not directly grow hair. Hair spa treatments are advocated mostly by people who are technically trained to sell the remedies. One thing to remember is the hair that grows out of the scalp is dead. It's like your nail. The nail and hair are made of the same protein. So whatever you apply on the nail or hair is not going to affect anything inside the body. It doesn't strengthen the hair, it doesn't grow the hair better, but it makes your hair look better for the time that you have the effect of the spa treatment done. So for the next few days, your hair is definitely going to look better, but it doesn't change the strength or growth of the hair. These spa treatments can make your hair manageable, but they do not change the growth or strength of the hair. Now, most of us have to keep ourselves presentable, so we find that patients are getting into a habit of regular ironing and blow drying their hair. Excess heat and excess cold both cause hair loss. Exposure of heat, even during steam sauna treatments, you should wear a wet towel on your head to prevent the effect of the hot steam. Regular blow drying and ironing breaks the SS bonds in the hair and changes the natural bonds to make the hair straighter. So the bonds are weakened and they definitely make your hair weak, leading to more hair loss. So doing these things once in a while is okay. Definitely don't fall into the trap of doing this every day or every other day. Wearing a cap continuously or wearing a helmet at work prevents ventilation and aeration to the hair. There is no ventilation, so if you are wearing a cap, every 30 to 45 minutes you must remove the cap, expose yourself to a window or fan, have good ventilation, you could wear the cap again. But lack of ventilation causes sweating, accumulation of secretions from the scalp, oil, excessive dandruff, and leads to hair loss. So a lot of patients are fitness conscious. They go to gym, they take whey protein, they take high protein diet for good health, but they are still losing hair. The drawback of high protein diet is excess protein in your body changes to amino acids at the end of the digestion. The amino acids make the blood acidic. Acidic blood is not favorable for hair growth. And if the blood is acidic, calcium in the body is the best buffer system for countering the acidity. There is reabsorption of calcium from the bones and the system back into the blood to buffer the excess acidity created by your high protein diet. Also, your liver and kidney are working overtime to clear the urea nitrogenous waste created by your high protein diet. So acidity and lack of calcium created by high protein diets easily leads to hair loss. A lot of patients think that it's good to just sip on a glass of juice, or instead of eating food, skip their meals or have juice in between. But ready-made Tetra Pak juice contains preservatives, antifungals, even insecticides to a certain limit. Unsold juice box can remain on the shelf for 1 or 1.5 years. In the process of creating the juice, most of these juices will tell you that they don't contain any fruit pulp. They are made without any fruit, but they taste like the fruit. Imagine the amount of chemical that is going into that juice. So having juices and colas gives your body a lot of pesticides, insecticides, preservatives, chemicals which are unhealthy, leading to hair loss. You would now think that it will be very good for me to have fresh juice. The process of crushing the fruit during the fresh juice causes loss of vitamins. If you are eating an apple, you dig your teeth first into the apple, the juice that comes out contains the vitamins, minerals, and essential vital elements. If you crush that apple in the juicer or in a mixie, the elements are all released in the juicer or the mixie and they don't reach you. So you could have fresh juice within 5 to 15 minutes of being created. At the most, would contain at least 40 to 50% of the nutrients, or else eat a fruit instead of juice is better, and keep away from synthetic drinks, colas, and packed juices. Now, a lot of people wonder that they are having a balanced diet, they eat very good quality food, then why should they require the use of vitamins? Today, we are in a universe where the nutritive value of food itself is lost. There is a study comparing the nutritive value of foods in the year 1950 and in 1999. During that more than 40 to 50 years of time, there is 30 to 40% loss of nutrient value of the foods. So, an apple today is not the same nutritive value as the apple was in 1950. And this is true with all your garden vegetables, fruits, and foods being supplied. Due to use of fertilizers, chemicals, use of hormones to increase the output of the food, the nutritive value of food is gone down. You just cannot meet your entire nutrition requirement by having good food selection. You need to have some supplementation to complete your requirement of vitamins, minerals, and trace elements. So if you're losing hair, it indicates that there is a lack of nutrition in your diet, and this has to be supplemented with minimum use of vitamins. A lot of patients come to me and they say that we are very good chicken and fish eaters and they are all losing hair. Today the problem is the chicken is no more a God-made food. It's an artificially created food. A chicken that should grow and come on your table in 1.5 to 2 years is artificially fattened in 4 to 6 months by using anabolic steroids, hormones. Oral contraceptives are being fed to the chicken to make them fatten faster. An unsick chicken is being injected with antibiotics, antifungals, antihelminthics so that the chicken don't fall sick at all. If one chicken falls sick, the entire poultry farm falls sick. So nobody can take the risk of one chicken falling sick. So here we think 10 times before prescribing an antibiotic to a patient. Their unsick chicken are happily being given with all these products, and you have the meat, all that goes into your body and plays havoc with your system. The fish are dying in their own water. The entire sewage and dirt of the world is washing into the seas. The fish are a major source of heavy metal poisoning. So whatever you select, whatever foods you like, do them in moderation. Have chicken or fish once or twice a week. You can definitely not have them every day. The role of eggs is in providing good biological value protein. The same principle as we follow for excess intake of proteins and creating a load of amino acids, making acidic pH in the blood, applies to eggs as well. In moderation, eggs are very good. High intake of eggs, especially raw eggs, can lead to biotin deficiencies, which is a very important vitamin for hair growth. So in moderation, eggs are good. Please don't have them in excess. Vegetarian people end up having some defined vitamin and mineral deficiencies. All vegetarian diets are low in vitamin B12. There is an important amino acid L-cysteine which is required for hemoglobin transfer in the body and for hair growth. This is not available from vegetarian source. So vegetarian people must supplement their vitamin requirement with some doses of minimum vitamins. Otherwise, pure vegetarian diet is known to give defined deficiencies that lead to hair loss. Restriction on lifestyle is important for your entire health. Regular intake of alcohol reduces the absorption of iron, folic acid, vitamin B12 from the gut. The epithelium of your stomach lining itself undergoes changes leading to known deficiencies and poor nutrition. So alcohol should be refrained from. Social drinking once a week up to 2 or 3 servings of hard liquor or 2 beers is enough for the week to save your hair. More than that is going to lead to hair loss. While smoking is concerned, the smoking causes constriction of peripheral fine blood capillaries that are supplying blood to the hair. The capillaries get blocked, the end arteries get blocked, there is no blood flowing to the hair roots, and naturally the hair goes into a sleeping or resting phase. After it is in a resting phase for 2 or 3 cycles, the hair is dead. So if you are smoking and you are losing hair, you need to choose between the two. You either smoke or you grow your hair. You can have 100 friends who smoke and they are not losing hair. They are born with a different kind of hair. Their hair can withstand the smoking. They are born with hair that is more stronger or resistant to these effects. If you are smoking and losing hair, please quit as early as possible. Yeah, today one of the most common causes for hair loss is stress. And stress related hair loss is due to accumulation of a scientifically defined substance P created in the body because of the stress. Now this can be countered by using antioxidants and vitamins. Antioxidants are extremely important to counter stress related hair loss. So we have an excellent program using antioxidants, iron, calcium, multivitamins, B complex, biotin, which are taken in a cycle to prevent stress related hair loss. The swimming pool water always has excessive chlorine to fight for regular contamination. So as soon as you get out of the pool, you should have plain water running over your head, which will remove the excess chlorine. You can also use a EDTA containing shampoo, which is called as a swimmer shampoo. We have an excellent product formulated for this purpose. So the chlorine will be removed by the EDTA containing shampoo, and we wear a swimmer's cap. When you wear a cap, you will prevent more contact of water with the hair and you can protect your hair. Another way is to oil your hair thoroughly with coconut oil or sesame oil, which will absorb and give a protective layer on the scalp, on the hair, to prevent the action of chlorine. Hair loss due to hard water requires a lot of protection. So you must oil your hair before bath. The oil which soaks into the hair will prevent the hard water from getting into the hair shaft and give you protection against the effects of hard water. You also have shampoos which can be pH balanced and which work in hard water as well as soft water. Selection of this correct type of shampoo is going to help you in preventing hair loss due to hard water. Air conditioned work environment are the newest curse of today's lifestyle. The new subject in colleges teaching about pollution is closed building environments. Pollution created in closed building environments. The closed building environments cause recirculation of the air through the air conditioning system, and volatile organic compounds originating from the air conditioning gas, from the furniture, from the color, from the polish, from the chemicals, they recirculate through the air and they have an affinity to get deposited on the hair and scalp. Hair and scalp has a property to attract dust and grime. They settle on the scalp and cause hair loss. Working on the ship, one is the desalinated water being used for all the utilities on the ship. And if you're working on a ship that transports chemicals, or more specifically petroleum products, the fumes of these chemicals get deposited on your scalp, and exposure to the fumes and chemicals causes hair loss. Working in night shifts has got one inbuilt problem, is people forget to drink water at night. They don't feel as much thirsty during the night as they would feel during the day. So one problem is reduced water intake, and second problem is change in the biological circadian rhythm of your body. So till you get used to the new rhythm, and if you accept it completely as a new cycle, that will help you to reduce the hair loss. And having adequate water, remembering to take care of your hydration and nutrition during the night shift will help you to correct the hair loss. Pain in the hair root is termed as trichodynia. So when you're combing your hair, you feel a dragging or pulling sensation in the roots. Sometimes you get it even if you touch your hair regularly. This is a sign of vitamin D and vitamin B12 deficiency. Apart from there being any other pathology in the hair which is causing an infection, fungal infection or subclinical infection also can cause pain in the roots. But more common cause is B12 and vitamin D deficiencies, which should be looked into immediately. These painkillers mainly come under a group of drugs which are called as NSAID or non-steroidal anti-inflammatory drugs. Regular use of painkillers interferes with the absorption of vitamins in the body and leads to hair loss. Hair loss can be treated irrespective of your age and irrespective of the grade of hair loss. Hair loss at any age, there is 25 to 30% of the follicles which are affected by the causes for hair loss, and they go into a sleeping or dormant phase. As they get into the dormant phase, you have 25 to 30% reduction in the hair growth. These follicles are still not dead. So with a well planned vitamin therapy and stimulation of these sleeping or dormant follicles, at any age you can get back 25 to 30% more hair. This hair will come within the areas where you have the hair. On the frontal hairline, on the receding temporal corners, the hair will not come back because these roots are dead. There is no technique in the world to make a dead thing alive. So those hair will never come back, but in areas where you have the hair and on the borders of areas where you have the hair loss, you can definitely grow back 25 to 30% hair at any age and at any grade of hair loss. Now, hair loss is related to multiple causes. There are more than 100 causes scientifically correlated to hair loss. It is very difficult to pinpoint a cause because these causes are vague. The hair is lost for causes like stress. There is no parameter to measure the stress. There is no way of getting rid of the stress. If a person is losing hair for stress, we cannot ask him to change his job, and changing the job is not going to grow the hair back. Lack of sleep, poor nutrition, there are many such causes which cannot be measured, and they can never be linked and confirmed to be the cause for hair loss. So cause-based treatment in hair loss does not work. Cause-based treatment is our habit of treating a disease. Hair loss is not a disease. It is slowing down of the body hair growth cycles. So rather than fighting the cause and chasing around with the causes, you should concentrate on improving the hair growth by stimulating better hair growth and having a hair care program. Also, usually there are more than one causes acting in tandem. Hair never falls for one single cause. There will be 2, 3, 4, 5 causes acting together, and all these can be treated by making the hair strong enough to stand for the cause. The same cause doesn't cause the same amount of hair loss in every person. If you say that stress is leading to hair loss, a bank manager given a target to complete and having hair loss, then all managers at the same post at the same target must have the same hair loss. This does not happen. So ultimately it comes down only to sensitivity and weakness of the roots. So strengthening the roots and promoting growth is a better choice than trying to pinpoint and fight the cause. Yes, you use a cream or lotion to stimulate the hair, and do not take all the nutrients together at a time. The nutrients also interfere with the efficiency of one another. You take iron and calcium together, they chelate each other, reduce each other's efficiency up to 40%. Excess use of vitamin A, vitamin E, omega 3 causes hair loss instead of hair growth. Hair is a very unusual organ. This is the only organ in the universe that grows when cells will die. You will be surprised that hair grows when the cells die. A normal cell gets filled with keratin, and a keratinized cell which is dead is pushed out of the body as hair and nail. If you have excess vitamins or a super saturated body with vitamins, the cells do not die. The excess vitamins interfere with the keratinization and lead to hair loss instead of hair growth. So we have a properly structured and studied program where we use the combinations to provide the best synergistic action of vitamins and give only combination of 2 vitamin sources per day. You take 2 combinations on Monday, the next 2 on Tuesday, the next 2 on Wednesday. So you cover 6 vitamins by dividing it over a 3-day period. This reduces the dose of the vitamins, reduces the cost of the therapy, and improves individual efficiency of the nutrients. This program will give you a rationed dose of the vitamins without any fear of overdose or side effects, and will lead to definite hair growth within 2 to 4 months. You don't have to use hormones to treat hair loss. A major misunderstanding created amongst the patients who are losing hair is that they need to change their hormone levels to treat hair loss, which is absolutely a misunderstanding. The change in your hormone levels has never been demonstrated clinically. Patients who are losing hair do not have raised hormone levels. As a doctor, I am taught to reduce the levels of something in the body that is abnormal or raised. So, with our treatment for hair loss, we never use any enzyme blockers or anti-hormones. Instead, we promote the hair to become strong enough and grow better. So, there are two ways of achieving better growth: either fight the damage or promote the growth. The damage created by the hair loss cycles is very slow. It affects 2%, 5%, 7%, at the most 10% hair at a time. The remaining 90% hair is still willing to grow. We bank on improving the strength and growth of the remaining 90% hair instead of fighting the hormone to take care of the 7 to 10% hair which is in a fall phase. So we do not have to use any anti-hormones to achieve good hair growth. Now, the most common remedy selected by patients as soon as they start losing hair is go to a medical shop and pick up minoxidil. In most countries, it is available as over-the-counter product. But people do not know how to use minoxidil, how to make it work effectively, and it does not work alone. When you use minoxidil, minoxidil is made in an alcohol base. The alcohol base is 98 to 95%, and the remaining 2 to 5% is the minoxidil. All the problems created are because of the alcohol base. The alcohol base causes drying of hair, causes itching. Unabsorbed minoxidil dries on the scalp and looks like dandruff. Minoxidil should be applied 2 times a day. Effective range of minoxidil is 2.5 to 3 hours. Your hair is willing to grow for 15 to 18 hours. But the minoxidil pushes it for growth only for 2.5 to 3 hours. So it is to be applied once in the morning, once in the evening, and if it causes irritation in the scalp, the irritation is going to go away within the 2 or 3 hours. Either you get used to it or then you change the product to alcohol-free minoxidil. Minoxidil has a property to bind to the hair protein. So it binds along the hair shaft that it comes in contact with. This causes a dull, frizzy or grayish layer kind of appearance on the scalp, on the hair. What you can do is use a hair serum to apply on the hair shaft to make the hair shaft look shiny again. You can even use 5 to 10 drops of normal coconut oil, rub it across your palm and apply it over the outer surface of the hair that looks frizzy to take care of the frizziness. If you're looking at not using minoxidil at all, or you do not tolerate the application of minoxidil, today the latest research gives you an option to use peptide creams. The natural signal in the body for hair growth is mediated through a combination of 3 amino acids that act as a linked group of peptides. This has been converted into a scalp application cream. You can rub the cream into your scalp. It stimulates or mimics the natural stimulation in the body for hair growth. This peptide cream is a good option for patients who do not want to use minoxidil or do not tolerate the use of minoxidil. Yeah, it does mean that you have to apply it for a long time, practically lifelong, but you can use it after some time. You could use it once a day. You could use peptide cream once a day and minoxidil once a day. You could use a lower concentration of minoxidil after initially getting benefit from 5%. You can bring it down to 2%. But yes, this is as good as brushing your teeth. You brush your teeth lifelong to keep them good. You have to apply minoxidil to your scalp to keep the hair growing. Most of the times when you use minoxidil, it does not work alone. There are 2 things required for the hair to grow. One is pushing the hair to come into the growth cycle. Second is providing the nourishment for the cells to divide. If you only keep on pushing the hair to come in the growth cycle and do not provide any support for the cells to divide and grow, it does not work. So the minoxidil is not designed to work alone. It will give you maximum benefits if you use it as the stimulus and then provide correct nutritional program to allow the cells to differentiate and grow. The application you use for hair growth is like a care program. there is a derangement or slowing down of your body cycles, and you want to push the body cycles to keep them going better. So this is more like washing your face, putting a moisturizer, or using a sunblock before going out in the sun. So whenever you want your hair to grow, this application has to be done. Now the bare minimum application we can use is converting the application rather than using it as a 100% product to be used in a strength of only 2% or 5%. Higher than 5% should never be applied. But this has to go in as a regular care program, and you have to use it till the time you want your hair to grow. This is true with any other product that you would like to use. It is not only minoxidil. If you find out a herbal hair oil that grows your hair, be sure the hair is going to grow only till you use the herbal hair oil. The day you stop using the hair oil, the hair will stop growing. So this is being bad mouthed that this is the drawback of minoxidil. It is not a drawback of minoxidil. It is a requirement of the hair growth cycle that whatever you use for pushing or stimulating the cycle has to be used as a regular care program. So between the choice of fighting hair loss based on the cause and strengthening the roots, it is much easier to choose strengthening the roots and making the hair grow better so that a strong hair then can stand for any cause. This is achieved by using two factors. One is pushing the slow growing or sleeping hair to come in the growth phase and providing it a good environment for growth. So the pushing in the growth phase is done by use of creams, lotions, hair growth laser, and various methods of inducting hair growth. You can even use growth factor injections, you can use PRP, you can use any method you like to push the hair to come in the growth phase. Once the hair accepts your invitation, comes in the growth phase, then you provide everything required for the hair to multiply and grow. This is the requirement of antioxidants that give a toxin free environment for the hair to grow, the requirement of iron, calcium, magnesium, zinc, the minerals which form the structure of the hair, the use of B complex, biotin, vitamin C, which are the coenzymes, catalysts that are facilitating the metabolic process of converting these roots into proper structured hair. Once you provide this nutritional program, that is how you will achieve hair growth. The full-fledged treatment goes on for at least 8 months. After that, a maintenance dose for up to 1.5 years, and then you can take a break. The natural hair growth cycle is of 4 months. You require at least half the cycle of time, that is 2 months, to see a result and to appreciate that hair growth has started. Now this is true for any other treatment also. A homeopathic treatment also should start giving you hair growth within 2 to 4 months, and Ayurvedic treatment should also start giving you hair growth within 2 to 4 months, because this is a biological cycle. We compare it to an analogy of having a baby in 9 months. The Ayurvedic baby or homeopathic baby is still delivered in 9 months. That's the biological cycle. So if your treatment and plan is correct, any pathy you use, you should get improvement within 2 to 4 months. In our patients, we start seeing an evidence of hair growth on the photographic pictures within 2 months and good results within 4 months. After 4 months, you are on a maintenance program. Depending on the initial deficiencies you have, you use a full-fledged program for at least 2 or 3 cycles, one cycle being 4 months. So at least 8 months to 12 months you use a full-fledged program. After that, you are shifted on the maintenance program. Maintenance program consists of using a hair growth shake or 2 scoops of powder every day, which contains multiple active herbal as well as nutraceutical supplements, or you can change the vitamins from 2 per day to 1 per day. The maintenance goes on for another year or 2. You can take a break in between for 2-3 months. Watch your hair. If your hair is thin, weak, slow growing, you need to start the vitamin again. But if you take a break, don't take the vitamins, you don't have any health problem. This is not like missing the dose of a diabetes or a hypertension pill. You can take a break anytime, watch your hair. If the hair is weak, please start the vitamins again. The full-fledged treatment goes on for at least 8 months. After that, a maintenance dose for up to 1.5 years, and then you can take a break. The hair loss program, as created by us using only 2 vitamins per day, can be used along with any other treatments that are going on. The entire program consists only of vitamins and nutrition. It does not use any drugs. They don't interact with any ongoing treatments. During breastfeeding, the application of minoxidil and breastfeeding must have a 3-hour gap. If you maintain a 3-hour difference between minoxidil application and breastfeeding, the program can very well be used along with breastfeeding. Minoxidil is the only drug for which studies during breastfeeding and pregnancy are not available. The drug anyway is only a 2% or 5% solution, is not taken inside the body. It is only applied externally as a topical lotion on the scalp, but still, to be on the safer side, in 2.5 to 3 hours, action of minoxidil is over. Rest of the therapy contains only vitamins, nutrients, which are very useful when you are breastfeeding. So 3 hours gap between minoxidil and the feed time should be a good way to follow the treatment during breastfeeding. Bariatric surgery typically creates a smaller pouch by bending your stomach. So the amount of nutrition or food intake you can take at a time is reduced. Post bariatric surgery, the patients are always advised to follow a well planned nutrition program. And the way the nutrition program is planned for our hair loss treatment, using only 2 vitamins or supplements per day over a 3-day cycle, is extremely effective for maintaining all types of source of nutrients and keeping a good nutrient level post bariatric surgery. So after bariatric surgery, this nutrition program will ensure not only stimulation and growth of the hair but maintenance of good health as well. In case of migraine, minoxidil is contraindicated. 2% or 5% minoxidil could trigger a migraine. Also, the alcohol base in the minoxidil could trigger an attack of migraine. So apart from the minoxidil, the use of biomimetic peptides and the vitamins can be carried out in case of migraine. Hair loss is also associated with a lot of specific disease conditions. Thyroid disease is one such condition. If your thyroid hormone levels are high, the metabolisms in the body are going super fast. They are consuming the vitamins and nutrients at a very high rate. So your body nutrient requirement is increased and lack of nutrition is going to cause hair loss. Now this can be treated by the same good well planned vitamin and nutritional support program plus hair growth stimulation. If your thyroid level hormones are low, then the low thyroid causes slowing down of the metabolic cycles. These cycles need more stimulation. So again, the stimulation and vitamin supply combined program is going to work. So whether your thyroid is high or low, you suffer hair loss, and both the conditions can be effectively worked out and helped with a well planned nutritional and hair growth program. PCOD related hair loss comes from hormonal imbalance. The hormonal imbalance is to be understood on the basis of nutrition. What is a hormone? Hormone is a set of amino acids. You have amino acids in one particular sequence, it is called insulin. You have amino acids in a second sequence, it becomes growth hormone. You have amino acids in a third sequence, they become another hormone. So if your nutritional level is disturbed, naturally you are going to get an hormonal imbalance. So without fighting the hormonal imbalance, if you correct the nutritional status of your body and stimulate the hair to come in the growth phase, you can definitely get 30 to 40% more hair in cases of PCOD. Post-pregnancy hair loss is mainly caused due to nutritional deficiency and discontinuation of the growing hormones in the body. During the pregnancy, A lot of good growing hormones are secreted in the body, which lead to formation of new systems, of new growth, and creation of a new baby inside the mother's body. On delivering the baby, the supply of all these hormones suddenly gets discontinued. So there is a fall in metabolic rate and you experience hair loss. The mother has also created a small body out of her own nutritional supply, out of her own nutritional storage. So after pregnancy, the mother's body is depleted of all essential vitamins, nutrients, trace elements, iron, calcium. All these need to be supplied after the pregnancy so that you restore the hair back to normal and restore the mother's health back to normal. Weight loss programs and crash dieting, even planned weight loss programs over 6 months to 9 months, do lead to hair loss. Whenever your body goes on a negative metabolic balance or breakdown, the first thing to shut off is hair. Body feels you can survive without a single hair on the head. So the first thing to shut off, or the first department to shut off, is creation of hair. Available nutrient and calories are used by the body to carry out important functions and not grow the hair. So when you are on a weight loss or a nutrition program, you must use a hair growth support program that contains the scalp applications and vitamins. This will ensure that you don't lose hair along with the weight loss program. The weight loss program is very well planned. It cuts down on calories but does not cut down on the nutritional requirement. So if you have a vitamin program going along with your weight loss program, the vitamins do not provide any calories but will take care of good nutrition. So this will ensure that you have steady weight loss without any health problems. Scarring alopecias are alopecias in which, due to the scar, the hair follicles have gone dead. There is nothing to make a dead thing alive, but the remaining surrounding hair which is present on the scalp, the quality, growth, thickness of this hair will become better. This hair will be able to cover the small patches of alopecia better and will give a better look to the patient. So though we cannot regrow the hair lost in scarring alopecia, we can improve the quality and growth of rest of the hair, which will be of much use to the patient. Scarring alopecia will have different outcomes depending on the source of the scarring alopecia. It could be self-limiting or it could be active. So at the time it is active, it should be treated by proper biopsies, understanding, cultures. Once the disease is burnt out, then it should be treated by hair transplant. Lot of patients come with the expectation that they want to make hair loss zero. We need to understand that hair loss is a biological cycle. The hair that becomes old and useless has to be replaced with good growing hair roots in your scalp. About 7 to 10% of your hair is always in the replacement cycle. If the hair loss is more than 10%, it can be brought to less than 10%, but you cannot make somebody's hair loss zero. It will become unnoticeable once it is less than 10%. When on the cycle and on the treatment, there are new roots that are being replaced with every cycle, and the number of roots replaced is going to be much more than the hair that is falling. So some amount of hair will fall, but you will be replacing more than 2 times the amount of hair that is being falling. In your mind, patients tend to connect hair loss with hair growth. They feel hair loss is an indicator of hair growth, but how many hair you lose and how many are growing back are two separate cycles. They are not connected with each other. You can keep on growing new hair despite also continuing to lose some of the hair. So the number of hair growing back is going to be much more than what falls. So though your hair is undergoing a fall phase, it is also regrowing at the same time. So do not worry about the hair loss you see. Counting the number of hair that falls is not a reliable way of judging how many hair is growing. To see the hair growth, you follow serial photographs and pictures, and you will always find that you are growing back more hair. You see the changes coming on photographs within 2 months, and to notice the changes, you need to take photographs at a specific location, same camera, same angle, same light, same distance every time. You see the changes in the hair along the parting line or along the front hairline. So when you have taken photographs in the front and on the side angles, these are the areas where you will see new hair growth. You will also see hair growth along the junction between the bald patch and the hairy patch. You will find that circumferentially these patches are becoming smaller and there is improvement in the hair growth and quality along the fringes. So you feel there are too many medicines because you have a box containing 6-7 different vitamins, but you are not taking 6-7 together. In order to reduce the dosage of the vitamins, what we have done is we have studied and combined only 2 that work better with each other on each day. So you take only 2 on Monday, 2 on Tuesday, 2 on Wednesday. The same thing repeats on Thursday, Friday, Saturday. Sunday you could have a break. So each vitamin which you should be taking 7 times a week in the cycle will come only 2 times a week. So the dosage and amount of medication you are taking, one thing is this is not medicine, it is only vitamins, and what you take is 3.5 times lesser than what we have been advised by the FDA. The vitamins advised 7 times a week, you are taking only 2 times a week. Yeah, despite giving each vitamin only 2 times a week, we ensure that the proportion, the sequence is matching the hair growth cycle and requirements of good hair growth. So you will still get a good result taking vitamins only 2 times a week. If you miss taking a dose in the morning, you can take it anytime during the day. If you miss it on a particular day, you can just skip it and follow whatever is advised for the next day. If iron and calcium in high doses is not tolerable, we can have formulations which contain a very minute dose of iron calcium, calcium given as calcium pentothenate, or iron given just 25 to 50 milligrams instead of the regular 500 milligrams. You can switch over to a gastrointestinal friendly program. It is called as the GIF kit, and a stomach friendly nutritional program is available that does not contain direct use of iron or calcium. Once you discontinue the program, immediately you cannot see any loss of hair. The hair gradually will become thin, weak and slow growing. Discontinuing the program for 3 to 4 months at a time is required. That is nearly one hair growth cycle to make the hair weak. So slowly your hair will become thin, weak and slow growing again over the next 6 months to 1 year. Laser therapy was discovered by Meister in 1967 when he was trying to study the effects of laser light on the back of shaved mice. He found that the mice that were exposed to half a watt of laser energy were growing the hair faster. So this laser therapy you can compare to photosynthesis in the plants being stimulated by exposure to sunlight, or standing in good sunlight so that the skin can create vitamin D. This is an inbuilt ability in our body. The endoplasmic reticulum in the mitochondria is responsive to light. So whatever sleeping or dormant cells in the scalp are stimulated by exposure to a particular frequency of light. Today we know the frequency of light required to stimulate the sleeping or dormant hair follicles. These hair follicles which are not performing, they are not in growth phase or fall phase, can be re-recruited into the growth phase by exposure to laser light. For every hair growth cycle, you have a fixed percentage of follicles that go in fall phase, and you have a small fixed percentage from this that go in a sleeping or a dormant phase. The applications and vitamins we use will not work on the dormant follicles. If you have an additional laser therapy once a week, then the dormant follicles are recruited back in the growth phase and the application vitamins will become effective on these as well. So you get an additional bonus effect of 20 to 30% more. We measure light in terms of watts. The laser, so we say a bulb is 40 watts, 100 watts or 60 watts. The laser is only half a watt. The night lamp in your bedroom is 1 watt. So using half a watt of energy on the scalp for 20 minutes once or twice a week definitely does not have any side effects. This has been studied by US FDA, and the laser device is a US FDA approved device to be free of side effects. It can be used as long as you like. You are being exposed to more severe light from many other sources as compared to this particular frequency given by the laser. So the phototherapy should not be feared at all. In general, in slang, it is called as a hair growth laser. In fact, this is just phototherapy with a light that is half a watt in strength. Gradually, if you do not use the laser, follicles that go in the sleeping or dormant phase will become dead. They are no more functional and you lose them permanently.